Hi guys, welcome back to my channel. So I'm gonna talk about the NCLEX session yesterday that I did. So it was like a sponsored study session with the Uworld in partnership with also, I think it's also like partnership with the National Student Nurses Association, so NSNA. It was a good thing though. Like I'm still a junior in nursing, but when they did the session, right? So they started with like NCLEX study tips. So one of the nurses over there, she kind of like talked about some testing strategies for nursing for NCLEX because so NCLEX is like a computer automated exam. So basically, she was saying that like minimum questions on the exam would be like 85 questions, and then the maximum questions you can get is like around 150, and then the time that they give you to actually take the exam would be 5 hours, right? So it's a decent amount of time. So they were saying that just to take your time in answering the questions, because again, the NCLEX doesn't really allow you to actually go back to the previous question. So once you pick your answer and hit next, um, you're not gonna be able to go back. And if you realize that you chose the wrong answer, so that was like the main thing, right? So out of the 85 questions that like the minimum, right? So 15 out of 85 would be like a trial question. So the researchers are using that to actually gauge some of the things that they would ask to the next in the next NCLEX exam if they can. Again, they're just trying to gather the data. Uh, so when it comes to computer automated testing questions, right? So it was saying that the first questions that you probably get would be like a medium difficulty question. So once you answer that, and then the computer would actually get an idea or assess you, like how your level, if you can answer like the more difficult question, or you have to go down one step down to like an easier question. So medium question number one, and then again, if you answer it correctly, they're gonna give you a slightly more difficult question, and then so on and so forth. And then you can shut down on the 25 question if you're actually like doing good and kind of like answering questions correctly. So they were saying that if you're taking the exam and then you feel like the questions are getting harder, it's also a good sign, right? So you're in the good track, that you're basically given more difficult questions because you were answering the previous questions correctly. So that's a good sign. So you just need to keep it up, right? And hopefully pass it with flying colors. But if you mess up the first question, or the other questions in the middle of the exam, it's gonna give you like a slightly easier question, and then they're gonna reassess you and give you the next question based on that. So that was like the thing that they were explaining, and so they also talk about the select all that applies. So it's called SATA, right? So unlike before, they were saying that it's more challenging before because you either get 0 points or you get like the whole points for the select all that apply. So now in the new generation NCLEX, at least like even if you didn't get all the select all that apply correctly, you would get partial points, right? So it's not. They were saying that it's no harm or foul when you pick the wrong answer, because it just like benefits you if you actually like get the correct answer. No deductions for the incorrect answer. So they started with that, and then we talk about OB-GYN, and then yeah. So there was a lot of stuff that like they talked about like hypertensive situations for like pregnant people, and how to like assess them, and what are medications that are contraindicated when a patient like experiences this. So it was a good thing. So most of the people that went to the session, like they're just like prepping for NCLEX. But for me, there's also other people like they still have like 3 semesters left before they can apply or become eligible for the NCLEX exam. But it's good that at least we're trying to actually we're trying to like actually like learn some stuff that like, and then strategy that that can help us in the future. So again, the more problems we solve, and it's also a good thing because like they give us like a practice questions every time, like by the end of the lecture, right? So you can have like answer the questions. So if you answer wrong, so example for me, like I like had like three wrong answers, but it's a good thing also like realizing that you don't know everything, right? So because sometimes like I hate it when people become too overconfident that okay, I know everything, like I'll get this right, like I need to be like 100% all the time. Like it's just like difficult to deal with that, like trying to be perfectionist and then trying to like, because it's just too pressure, right? So I mean I understand that with some people, like if they're like, so I already have a bachelor's degree, but I get that the new people like fresh from high school, like trying to like very competitive, whatever. But again, like they need to realize also like when you're applying for a job, it doesn't really like matter too much. Like even like nursing, right? BSN. If you got your BSN, you graduated with honors, right? So and then you apply for a job at the hospital. Like some hospital doesn't really care about your GPA. The only thing that they care about is NCLEX. So it's just like what's the point of having 4.0 or 3.5 or higher, and then you're gonna fail NCLEX because you had like test anxiety during the actual NCLEX exam. So and then I noticed that in the actual workplace during my clinicals, right, like some of the nurses that I work with that kind of like what you call this, like I followed or preceptor, I mean, like like when I followed them and then they're doing their job, most of them, like when I asked them like how they did in nursing school, like they told me that they did all right. Some people like didn't really care about getting good grades in nursing school because they have other priorities as well. So it's not like they're not smart. They just like they stop really like putting importance on that as long as you get enough information and be competent, right? We're not saying that you're not gonna like try to learn anything, but it's like balance it out, like not really like put in your head that you're like a dictionary, like medical dictionary, or like you're the med book that all the medications and all the, and it's like for me, like as a person, right? So like I know some people were like that. That's why like I don't really like like want to associate with those kind of people. But yeah, so it's a good thing though, like the study sessions. I'm not sure if they're gonna offer. I think they said like they offer, like the Uworld offers like 5 sessions a week with different categories, right? Not just like OB, or they can be like pediatrics, also diabetic, and so on and so forth. So it's very cool. So yeah, I just want to share my experience yesterday. It's cool. Again, thank you guys for watching. Take care.